Actually, when I was joining Matibabu, I knew I would get what I wanted. But I will say here, I got more than I anticipated.
So actually, nursing is a good course, and everyone who may get someone who wants to join a nursing school can come to Mary Ann Van Dam School of Nursing and get the most appropriate knowledge required to serve people.
I can say Matibabu has really modeled me to be a great nurse, and everything that I do currently in my practice, I just try to simplify what I was taught in class and apply them practically in the field.
I'm Susan Betty Achieng. I'm a Kenyan registered community health nurse, and presently as I speak, I'm working at Siaya County Referral Hospital as a nurse.
I'm Mesha Kotiano Ongonge. I'm currently working at Matibabu Foundation Hospital.
Uchin Victor Wasonga. I work with Aga Khan as an accident and emergency nurse.
In Mary Ann Van Dam School of Nursing, our standards are different. Everything we'll do will always be reflecting on the patient's need, because that is what we are there to check out.
I can say Matibabu has offered me a great support into modeling me being a nurse, especially a nurse that can offer quality care that is required by the patients, by the family members, and by the organization itself.
My school has the best to offer in terms of lectures, skills labs, the practices that we undergo in the labs. You see, our lectures are not just any lectures. We get to discuss with our tutors, we get to discuss with our lecturers, and even come to an agreement. Because at the end of the day, everything must be, we call it in nursing, evidence-based. So we are taught in Matibabu to practice that which appeals to the patient, but is also evidence-based, so that at the end of the day, we have a safe patient and a safe procedure.
It has a skills lab that is well equipped with the modern equipment that facilitates learning.
Talking of our skills lab, we have all sorts of mannequins, and we do practices on them. So it means before we get to the actual field, we are able, and we must have practiced enough on the mannequins so that we are able to be safe and free from minor accidents. Because this is, anything health is dealing with human life. And therefore we are not going to be experimenting with human life. We'll be experimenting with the mannequins. By the time we get outside there, I tell you, nurses from Matibabu are ready to handle the patients.
Matibabu as a foundation. This is a foundation that does not only educate you on theoretical work, but it also equips you with the necessary skills that will help you carefully handle your patients in the field, be it on assessment, be it on diagnosis, be it on planning, be it on intervention care.
The lecturers in the all college are good, well equipped with knowledge. They deliver the maximum. They could also sacrifice and teach us in extra times and also during holidays to ensure that we get the required knowledge, in that when we go to the field or do exams, we do our best.
People who resort to do medical courses are worried over the cost of the books and maybe how to access the course books to facilitate learning. But in Matibabu, that is not the case, because we have a fully equipped library. You can walk in any time of the day and do your study. You can even be able to do other researches via internet, because that is also available. So even as a student joining Matibabu, you were only worried about other things. The books, the course books to read, Matibabu will always provide. Because even if you are not able to get one of your own, when you get into the gate, there'll always be a reserve book for you as a student. That is one thing about my school, Matibabu.
Currently, I'm an acting theatre nurse, but I'm flexible. I get into various fields like outpatient. I can go to MCH and also help there when there is heavy work. I can also go into inpatient department and help 1, 2, 3 when my colleagues there are overwhelmed with work. So I do my work with passion. I like my work, and I always feel good when my patients get better services and they recover.
My being a student, a Matibabu trained student, has enabled me get this far within the few months of my completion. Because Matibabu in itself, Mary Ann Van Damme School of Nursing, is known all over. Our nurses are outstanding. You get into a ward setup and the nurses, they are like, are you from Matibabu? You are the manager of the day. Because they always have that confidence in us. So when you come asking for job, you go knocking offices. The moment you mention Mary Ann Van Damme School of Nursing and you have your papers to support that, you are employed. That makes Matibabu a wonderful place to be, because your future, your security in terms of job is guaranteed as a student.
So I would like to encourage anyone that will want to become a nurse, and not just a nurse, a passionate nurse that is always developmentally driven to offer great care to the patients. I will recommend that you join Matibabu Foundation so that you can achieve that dream. Thank you.
Matibabu has given me an opportunity during my training period to get experience from all departments that run in the hospital. We get to be placed in different departments at different times as is stipulated in the manual, in the curriculum, nursing curriculum. So by the time we are getting out of Matibabu, believe me, you have gone through all the places you need to go through. You have the experience you need to have, and you have the theory you need to have. So what's going to stop such a person from performing in a place of work? Matibabu is the best place to be. And the cost is worth it. Because at the end of the day, you are going to be the preferred one. So Matibabu is the best place where any nurse can get what she wants.